Well, good afternoon. It's such a pleasure for me to be here. And I really wanted to thank Louise and the Harvard Global Health Institute to allow to co-sponsor this wonderful session together. So this session will elevate diverse perspective and development, deployment, and the impact of artificial intelligence in global health disparities. As many of you probably know, the opportunity to advance AI and to address really fundamental issues in global health is there are enormous amount of opportunities, and there will be a really prominent group of panelists that I'm sure we'll talk about. Some of the opportunities that just I wanted to mention that are being reported more recently is basically the opportunity for AI to close the vaccine coverage gaps. So basically they can understand it by looking at satellite images who needs more access to vaccine. The potential for AI to accelerate vaccine research. The potential for AI to empower frontline health worker, for example, with this now AI-powered large language model, the ability to improve disease surveillance and outbreak prediction, and to enhance clinical decision support. I'm guessing that some of the panelists will also talk about the many challenges. Some of the challenges is the lack of infrastructure and resources, the cost and affordability of AI technologies, and there are a lot of ethical and legal issues around data privacy. So it's my great pleasure to introduce the speakers and the panelists. Will be Dr. Milind Tambe, that is the principal scientist and director for AI for Social Good at Google Research. And on the weekend is a Gordon McKay Professor of Computer Science and Director of the Center for Research in Computation and Society at Harvard University. Dr. Austin Demby, the current Minister of Health of Sierra Leone. Dr. Judy Gichoya, Associate Professor in the Department of Radiology and Imaging Sciences at Emory University School of Medicine. And lastly, our moderator is Dr. Adeline Boatin, Assistant Professor in Obstetrics, Gynecology, and Reproductive Biology at Harvard Medical School. If the speakers could take the podium, please. Thank you.
All right, you got the mic on? Mm-hmm. Thank you so much for that introduction. And I'm so happy to be here with this panel here. We have the wonderful job of keeping you all engaged after lunch, which I'm sure is not going to be hard. As you hear from the introductions, we have very diverse perspectives here on this panel. A minister, clinician, professor of computer science. So I want to really leave time for us all to engage with them and ask questions. So hopefully people are thinking about questions they can ask when we open it up for them. There are a lot of things to discuss today, starting from thinking about AI has gone, I think, it's not a new topic, but it's certainly undergone a rebranding since ChatGPT came out. That was November 2022. How many of you have used that? Great. And so definitely rebranded. It's a topic du jour. So many articles about this, lawsuits going on around the data use around this, a lot of regulation and ethical challenges to think through. So I'm hoping we can get to a lot of that today. But to start off with, I wanted to give space for each panel to talk a little bit about really some of the tangible ways AI could be used, the reality of AI for global health, and really take us away from some of the hype and the distraction to what's actually possible or potentially already being done. And we can maybe start with you, Professor Tambe.
Okay, so over the past 15 years or so, my research has been focused on how we can use AI directly for society, focusing on topics of public health, conservation, and public safety and security. Key challenge is usually we have limited resources, so how to optimize the use of these resources. So with respect to public health, one of the projects we've worked on is with youth experiencing homelessness in Los Angeles here. The challenge is that we have limited public health resources. So here, the challenge is how to select key influencers in order to spread HIV risk information. And we are able to show that our AI algorithms are far more effective in choosing the right influencers to spread HIV information and reduce HIV risk behaviors compared to traditional approaches like picking the most popular youth. And we've shown this in field trials in LA with these youth. Another example is with the maternal and child health in India with a nonprofit. The task there is that this nonprofit uses the proliferation of cell phones to send out health messages from the time the mother registers to the baby being 1 year old. Every week, there's a health message that goes out on the cell phone, an automated health message, mobile health program to take more iron, take calcium supplements, and so forth. The trouble is that mothers register into this program and then drop out of the program. So how to prevent that? But there's 200,000 mothers registered and 1,000 interventions that can be conducted by giving live service calls or by visiting these mothers. So which 1,000 out of the 200,000 to select? Again, this is something we built a program, an AI program to make these predictions and optimize, and shown in field trials that this leads to a 30% reduction in the drop-off rates, and deployed the program with the nonprofit. And it has been in deployment for over 2 years. These are just two examples of the kinds of applications that can be built with AI. I wanted to emphasize some of the key lessons that we've learned here. One is that these sorts of social impact applications and AI innovation often go hand in hand. It's not the case that there's off-the-shelf tools that can be really deployed. Example is that how to choose influencers in a youth network. Well, the traditional computer science literature says you take as input the whole social network, and then I can give you as an output who are the influencers in that network, sort of exploiting some graph properties. But in reality, there is no social network available to us of these youth. So the whole question research becomes, how can you efficiently sample this graph in a way so as to spread this influence, these messages most effectively? And these kinds of questions only come up because we try to deploy these systems in practice in the field. A second challenge, as illustrated by the fact that there is no social network, is that these are all low data regimes. So whereas we are supposed to be swimming in this large, big data universe, many of these domains, there's very limited data. And so all of the innovation, often the PhD is actually figuring out what to do with low amounts of data with AI algorithms. And what has been said throughout the morning today, partnerships from beginning to end, that is obviously extremely crucial to make these AI systems actually work in practice. So I'll leave it there, and we'll come back to questions later.
Thank you so much. We'll on to Dr. Gichoya.
Yeah, so thanks everyone for the invitation, and I really enjoyed the morning sessions. They made me a little sad, just remembering what it meant to be a global health researcher before I started doing AI work, which is a very, very exciting topic. And I think that's what I want to start off with. And so my work is really around 4 domains. One, building diverse data sets as in the US, and also looking at how bias and fairness works in algorithms, and then validating AI in the real world setting, and then training the next generation of data scientists. And so in my reflection, as someone who also spends a lot of time, I'm an interventional radiologist, so I spend a lot of time back home in East Africa. I would say that I think right now there's so much hype, and unfortunately with the GPT models, there's even worse hype. And most of the things that you'll hear, now they may not be new to the people in this room, but you'll hear there are not enough doctors, AI can help, okay? Everything, now in the US, the message is doctors are tired, AI will help. But if you think about the practicality of deploying AI system, it's very, very difficult. I work in an institution in radiology where we only have 2 systems. One is a stroke triage, and it's not because it catches more stroke. It's because if you have to track all your pipeline to when you have to activate a stroke and how much documentation is required, it's very easy to use a mobile phone. So it's not even any of the AI systems, it's the workflow that is so important in making a difference for these patients. And then the second one is a triage algorithm. There are not enough radiologists, despite many of the giants of AI saying don't train radiologists, which is a little bit of the message we hear in the global health setting, that if you have a long list of CT scans that are not interpreted, then you don't want to be embarrassed calling the patient, oh, I'm so sorry, I missed a bleed or something like that. So you have this algorithm, even if it doesn't do a good job, it bumps up the patients who may have critical findings, so they are attended to earlier. And so if you think we do a lot of AI research, the institution has a big AI research endeavor, but we only have using 2 systems, 2. So I see sometimes back home, you feel like you're late because you're not adopting this technology. And one of the biggest challenges is to understand what's hype and what's reality. And so reality, to me, is that the same discussions we talked about, financing, capacity building, and are there going to be the same challenges when you think about AI development and deployment? It's becoming very difficult for people who live outside the developed countries to get visas. But the biggest next workforce is going to be from the African continent and Latin America. But those people will not have mobility, and that's okay. But when we think about those jobs for them in this era of AI, we think of them similar to the people who come to pick agricultural products here. It's the same work that is reflected in the Times when you see that the people in Kenya, all they're doing is validating that our Facebook feed is not filled with pornography. And so we're not really challenging what these future jobs are going to look like and how they will be performed when those people live in the village that I grew up in and in the infrastructure that is necessary to do that. And then on another end, we talked about political changes. We are going to an election year. This year is when Americans will really understand what the power of AI is and who we are letting control this power, which is unfortunately the big tech companies. And we are going to see generative AI in its worst forms. And so election and democracy is threatened by AI systems. So as we talked about the challenges of financing, the challenges of how we provide care, it's not just the direct deployment of AI systems, it's going to be the misinformation, it's going to be changes in democracy that we're going to witness in these areas in the global south that are burdened with another disease. So our work of policy is going to really need to change, and we have to be ahead, not just because of the patient who's ahead of us, but because of the bigger context that we deploy AI systems.
Thank you so much to delve in there, and hopefully we'll get to some of that in a little bit more detail. Minister Demby, love to hear your perspective from a national level, from government, thinking about deploying AI for health.
Well, thank you very much. First, I have to say thank you to Louise for such an incredible welcome here. Coming to Harvard, you feel that there's the space to really have serious dialogue, even if it's controversial at some places, but if you can't have it here, you can't have it anywhere else. I think the issue of AI for us in the South, especially in a country like Sierra Leone, is paramount. So you're not looking at technology, that looking at for something to solve. Here we have some very, very serious problems that we've been grappling with for quite some time. And you see an opportunity where AI could be actually complementary or supportive of what we want to do. And for me, the biggest lesson here today is, I've heard it a few times, is having the ability to listen and the ability to hear. For a country like Sierra Leone, we have about 800 physicians for 8 million people. It could be a lot more doctors out there, but as we train them to leave anyway, but that's an issue for another discussion. But now that you have all of these people, we are also in the process of completely rethinking healthcare delivery in Africa and in my country, Sierra Leone. We don't want to glide into 2030 with the SDGs. We want to significantly bend the curve, double down on some of the successes that we have. And so we see AI as a potential tool, a potential ally in this effort. We're looking at new ways of approaching this. I think we're concerned that in a lot of cases, there's siloed programs that are ongoing, that are very well supported. Sorry, David, but I don't want to have a situation where I have the best malaria program with all of the vaccines, with all of the insecticide-treated nets, with all of the Indian residual spraying, and all of the drugs available, and this baby dies of a respiratory disease. In that case, we've all lost. So we're completely rethinking healthcare delivery around the patient, around client and patient-centered care. And how do you bring all of these interventions with a focus on the health outcome of that individual? We are also looking at it through the life stages approach, starting from pregnancy, ensuring that you have a pregnant woman who's healthy and strong and has a safe delivery, and ensuring that the baby doesn't only survive, but the baby thrives all the way to kindergarten, that the baby is ready for school, and at school they have the requisite health delivery in school that will allow them to focus on education till they're young adults, till they're senior citizens. Now, looking at all of this, this is clearly not material for a paper-based system. To be able to see how all of these interact and have a patient come in front of you and look at it as a 360 requires real innovation, requires the potential for what AI could offer. So for us in Sierra Leone, our biggest task is to define this problem that we're dealing with and see how we work with you all to come up with solutions. I mean, a good example for us is we've been able to reduce maternal mortality by over 60% nationally. Now, we don't want to glide, the numbers are still high, we don't want to glide to 2030 by just continuing to reduce it at that pace. We want to completely disrupt it and ensure that every pregnancy counts. And we'll make sure that we influence that pregnancy for a safe delivery. And so we develop an app that will look at pregnancy registration, that will allow you to look at all of the facilities around you, that will be able to identify the closest facility to you, by identifying a caregiver that will focus on this pregnancy and walk with you through the required 8 visits instead of 4 to ensure that everything we see, if it's high blood pressure, we'll manage it. If it's diabetes, we'll try to manage it. If there are all comorbidities, that we manage it. And ensure that we also have geolocation for this, such that if you're in normal pregnancy, you come out as a green dot. If you have comorbidities, it comes as a yellow dot. If we lose a pregnancy, it comes as a red dot. And so I could sit here and open my laptop and see the heat map for the country and see where the yellows are, and look at interventions that we could go in there and address the need to convert those yellows to greens. If there's a red, we want to know what happened so that we will prevent it by the next week. So we don't want to wait for an annual report. So to manage all of these, it's a very complex mix. And I believe that there's a potential for AI to not only help us look at this holistically, be able to identify high-risk pregnancies, be able to get them closer to service delivery, be able to move them and influence the health outcome of that pregnancy. So we want to use AI as a tool to help us address these issues. And I don't know, I think it's one of the greatest opportunities that's been presented to us. And I want these big thinkers like you to help us as we identify these problems, to bring these solutions to bear and influence health outcomes. Maybe I'll just leave it at there for now.
Thank you. Thank you so much. So I think AI is here to stay. It's not going anywhere. We recognize the potential that it offers. I think you've highlighted very clearly also that it's not waiting on the shelves. It's not something that we can take off the shelves and just implement tomorrow. It's going to take some work to get it to where we need to. So the question for the panelists here is, are we doing enough currently? And if not, what should we be doing to make sure that as we think about tackling global health inequities with AI, we're educating the workforce or the researchers who can help us get these solutions in place, and also creating the partnerships that we need to get that in place. Who are the partners that need to be there? Who are the stakeholders? And how do we make sure that they're introduced at the beginning as we begin this journey?
I can start. So I guess so there is this area of AI which has been emerging, I would say, since 2016 when the White House held its first AI for Social Impact workshop. We have this expectation as an AI researcher, and I guess that will be perhaps my role on this panel in AI, that we will train students with methodological approaches to AI, which is the traditional education, get them whatever PhD, et cetera, and then expect them to go work with AI for some global health applications and so on and so forth. And it doesn't work like that because they're really not educated well in being able to deliver these AI solutions because they are methodologically strong, but there's so many other things to get AI to actually be useful in the field, and leave aside all the other challenges that have been mentioned with respect to financing and so forth, but just trying to understand how to build a partnership, there's things like implementation science, the building ethical, responsible AI systems, even just doing field experiments when things are very noisy. These are things that AI researchers may not know of. And in fact, dealing with these low data regimes that I've mentioned earlier, in fact, I've had sometimes students who will go into a situation and expect, they met with a nonprofit partner and say, well, they didn't identify a mathematical problem for me. Because the idea is that the first meeting we have, there'll be a sum over I, xi, and off we go trying to, and that's just not they don't even know what AI can do. We don't know what their problems are, and identifying the problem and the model is actually the first part of innovation. So there's a lot that needs to be done in terms of AI education. And it's been my effort to try and identify this. I'm reminded myself when I learned about AI, late 1980s and so forth, there's no textbook. There's just like a bunch of papers we used to read, and all the other colleagues in the computer science, all the other graduate students who tried to convince us this is all BS. There's no such thing as AI. They're teaching you nothing. It's thin air, and you should do real computer science, which is not AI. And now we've arrived where there's a textbook, and obviously AI is such a big influence all over. AI for society, I feel, is a similar field. AI for global health, perhaps, is a subfield where we need to develop what is it that students need to be taught. AI is not something which is some natural phenomenon. It's something that we are going to shape by ourselves. And so how can we get the newer generation to shape this AI in a more beneficial direction for society? And so this whole field needs to be developed, and this will obviously be a collaborative effort in terms of being able to develop this curriculum. And hopefully, eventually, from where we are today, where in my class I just tell my students exactly like I learned AI, learn AI for society by reading a bunch of papers, because we don't know what is in it. We just know there is an it, but we don't know what it is. That we come to a point where we develop core techniques and ultimately have a textbook that is more dedicated to this education of AI for society, AI for global health. So I have a lot more to say, but I'll stop here at this part of the question and perhaps return after others have answered.
Sure.
Yeah, I think I really, I applaud my colleague, and I think that's why we're here. I'm not an AI expert, but I'm here to define a problem that I need solved. And so I think it's important to get the basics right and to have data sources available. And I think what we do in the public sector is to say, we have this problem. I mean, I'll tell you, I mean, some of the work with imaging and you know, people struggle. There's a problem, you know, you have these x-rays and CT scans that people take forever to interpret, and you have to send it back to a university somewhere, and they interpret for you. By the time they come, the patient is dead or the patient is gone somewhere, you know. That's a problem, you know. How do we create algorithms that will allow you to have a handheld ultrasound and send this doctor to a remote village in the middle of nowhere with this device in hand that will allow this person to do a quick scan and narrow the diagnosis and narrow the differential diagnosis and see if they need to call headquarters for assistance with a digital image in there. So these are practical things that we're dealing with. Like I said, we have 800 doctors. We need 8,000 doctors. There's no way we're going to produce those 8,000 doctors over the next 6 years. But the few that we have, we could allow them to stretch. We could give them the additional tools so that this young doctor who's in the middle of nowhere could have these additional devices that will help them out in the diagnosis and in patient care. You know, I think, you know, with all of this data now, I mean, when you have your sharp PhD students graduate with a first-class honors somewhere, you know, I want to say, come to Sierra Leone and help me look at what a clinical officer has to deal with 1,000 miles away from headquarters. They're there. Could you develop an algorithm for me that will help this clinical officer narrow down the diagnosis so that they're able to provide care? At least minimize the number of referrals to the higher level that would allow them to. I mean, if you did that for us, we will be so happy. The continent will be so pleased. And again, for me, it's not having a solution that's looking for a problem to solve. We have real problems that we're dealing with. And we would like your bright young students who have the basics and the standards to come in and see what are potential applications of these new skills that you have that will allow us to change healthcare delivery in our countries.
I'm going to disagree with the with the minister.
Prime Minister.
It's a prediction. It's a machine learning prediction. Well, you know, but thankfully I'm not from Sierra Leone, so I don't have to worry about not going
opposite side of the continent. It's all right.
You know, so I don't think we should build that algorithm. And this is why. And it's just because it's never going to work. It's going to give us false sense that it's working. And I'll tell you that this year I went to teach interventional radiology and support one of my doctors in the cancer hospital in Dar es Salaam. And I built around 100 algorithms every week in my lab. And I never built them initially for diagnosis. And as I sat near the radiologist, I realized they had no idea what they were doing. And I went home, back home to Kenya and back to the US, thinking I need to change and build that algorithm. But if you think today where Professor Tambe is going to build the work, it's going to be built on American data. It's going to, because you may have some data in Sierra Leone, but it's not ready yet. And that algorithm is not going to work for you. And so to me today, if you say, Professor Tambe, give me help, let us organize. If the National Health Insurance Fund is paying for all the patients, they should be mandated that all that data is deposited back to the ministry so that as a service, because you know there's quite a lot of fraud. I know that from the Kenyan context. And then I can come and say, oh, here's an algorithm. You have very simple infrastructures. And this is where true partnerships can make a difference. I don't know that there is a cloud vendor in Sierra Leone. And it's very expensive in some of the parts. Now in Nairobi, we do have some of the big tech companies, but it's extremely difficult to set up this infrastructure on the continent. What's the data governance? Are we going to see data colonialism where the data is collected from Africa and then used to train algorithms from North American researchers who become the first and last author, and no benefit flows back? So to me today, it's being local, and I'll give a shout out to Jessica, who's working on a similar project in Uganda. It's not easy, but we need to be, you as the minister need to be sitting in the Minister for ICT and saying, what rules are you going to govern to say, I'm not telling the minister to do his work, obviously, but, you know, and you need to be saying, what rules are you adopting? Are you adopting GDPR? Can we enforce it? You know, should we just say, let's keep our data in the nearest server close to us if it's in Europe, but the governance is strict, it's different. And so those are lessons that I, as someone who practices, have had to readjust my way of thought. And today we organize these events where we bring clinicians, we bring data scientists, we bring computer scientists, pretty much clinical officers together for locally generated problems, for them to be solved with local data. And that is one of the biggest investments that we've made around the world. And it's painful, but it teaches you almost, it saves you almost 5 years of mistakes. And to me, that's what I would say today, more than send your PhD students, who will absolutely love, I want to go to Sierra Leone, and just not really have a meaningful impact in this new technology.
Can I just react to that? You know, thank you very, very much. Thank you for your counsel, but I'll let you know. I'll let you know that in Sierra Leone, we've invested in basic data, and we've invested in an actual roadmap for data and the data governance and data structures that are going to be the baseline for all that we do. So there's a very proactive process in this, and there's a very deliberative process in it. So when I told you about this app that we developed, it wasn't a random issue. It's just one of the products that have come out of this harmonization of our approach, and there's a deliberacy around it. What we don't have is the number of bodies that will help build this. So again, I'm still asking, if you have these incredible, talented people who are looking at problems to solve, come to Sierra Leone and come to the region as well, because I think what we're looking at is all of what you highlighted are problems. What problems are there to be solved? And you have an opportunity to solve these problems. We're not going to wait for somebody to come in and solve these for us. If you're looking at harnessing data, there is no way you're going to utilize this data if you don't have strong data governance issues, if you don't address the ownership issues, if you don't address the use issues. I think these are important ingredients that form the basis of where we want to go. And thanks for the counsel.
That's why he's going to be the prime minister.
We have a response, and then we'll.
Okay, so I mean, we had a pre-panel, and we had a lot of fun because I think we just kept responding to each other. But I think you know, to the point about building real partnerships, it is really important that we have in sort of building AI solutions that actually work in the field, that these be beginning to end partnerships. It is a problem-first approach. It's a partnership-centered approach, as opposed to, I have my favorite AI technique that I'm going to be continuing to publish on. I'm going to take every problem and just apply my technique to it. And so this requires certainly a lot of humility also from the AI researcher. And so I think one of the things we probably also need to teach AI researchers is humility, not that they don't have, but just that there are these sorts of approaches of really trying to go to the problem. And yes, there is a lot of hunger, I would say, among the younger AI researchers to say, how can I use something that I have learned for applications to society? At least I certainly see that in my classrooms and so on and so forth. But the question is, where are the problems and what are the right kinds of problems and how do we teach them to take these problems on? And I guess earlier in a panel there was a mention, that it shouldn't be the case that we take a problem and go back to our ivory towers, develop a solution and come back, here's a solution. So this would be a very much beginning to end, really just sort of figuring out how every step of the way the solution is exactly what is intended to be. And so, I appreciate what you were saying, but I think really partnership could be an antidote, just sort of well-grounded partnership to some of the concerns that you've raised.
I did promise you a lively discussion to keep I'm glad that we're delivering. So I'm going to ask one more question and then we'll open it up to the audience. And you touched a little bit on this. I think one of the big challenges around AI and developing this and using it equitably is around data governance and ownership. And data is now the new currency, right? Like you see lawsuits going on about who owns what. These open AI companies have already scraped everything possible on the internet. And ultimately, the data comes from people. And right now, you think about where the most people are, it's in the global south. And so there's this opportunity to gather a lot of data. But are we doomed to fall into our failures of the past in terms of governance? Are there opportunities for new structures? How do we put these in place now so that we don't fall into the same pitfalls? Solve the world for
I think
us.
the Prime Minister, the Minister should answer this first to really give, I think, a real-world experience.
No, I think it's a very important thing that we're dealing with, and I must emphasize at the outset that Africa is changing, and we should pay attention to the changes that are occurring. We have the youngest population in the world. For example, in my country, Sierra Leone, the Prime Minister, the equivalent of the Prime Minister, is 34. My Deputy Minister is just is in the audience. Yeah? This is the era of young people. And the kinds of things that we used to get away with, it's no longer countenanced. I think the young people are smarter, they're brighter, they're asking the right questions. A lot of them studied here with you, and they're back home leading institutions. And so when we say partnerships that were built on, I have the funds, I tell you what to do, and you go ahead and do it, was something that went on for far too long. Now the younger scientists are asking questions. Now the younger scientists are saying, why? Why? Yeah. And I think it behooves us not to be cognizant of that. That's why I started by saying two things. Listen and hear. Because I think what the people are saying now is mutual respect. We know where this data is going. We know how this data is being used, yeah? We want to be a part of that at the outset. And that is built on mutual respect. If we don't pay attention to that, you'll find out that there's these invisible glass walls that pop up. I mean, the alternative to that, when people are collecting their data and they'll hold on to it. I'm not going to share it because I know when we share it, what the consequences are going to be. Somebody else is going to write 10 papers out of it, and we don't see a thing. We had an Ebola outbreak there in Sierra Leone, and we fought hard to conquer it, you know. There have been hundreds of papers out of that. I'll need to see how many Sierra Leoneans are in those papers. You think the next time, God forbid, another outbreak like that happens, people are just going to say it's okay? It's not going to be okay. So I think what I'm saying is the environment is changing, and we really need to be nimble and adaptive and be respectful and work and make sure that there is co-creation, there is co-utilization, there's co-use of these products. And for me, AI is a new space. The issue of leapfrogging is right here in our faces. Don't underestimate the South. The really, really bright people out there who are looking for opportunities. Let's treat them with respect. Let's come in and let them pose the questions that they're dealing with. Let's co-create the solutions that are there. And then let's see what the end result of these products are. That the West benefits from it, the North benefits from it, the South benefits from it. We all take credit for this product. And it requires some deliberacy. It requires some modesty. It requires some, you know, I've got the data, I've got the patients, you may have the technology, you may have the knowledge and the funds, but those patients reside here. So how do we create a space where we will support each other, we'll respect each other, we'll find the solutions that we will benefit from as the South, and you will benefit from the glory of it as well. But at the end of the day, my personal interest is in the health outcomes for our people.
Just additional, I think that not just from Ebola, but also from COVID, there is quite a lot to be learned. I think Dr. Moyo, who's could be on this panel talking about the consequences of releasing the genomic sequencing of the variant on the continent, and how still most Africans are not immunized against this variant that was initially sequenced on the continent. And not only that we saw a lot of travel bans that resulted from it. And so for sure, the next pandemic or the next disaster, in terms of rethinking data sharing and the consequences, is definitely going to be front and top of mind. The issue about data governance is an evolving issue, and not just for the Global South, but even in the US. And this is because while data is the new oil, annotation of data is very expensive, you know, and so you can have a big ton of data, but if it doesn't have not good outcomes, but just some form of outcomes or the annotations, it's extremely difficult. And so I think what's challenging in the era of collecting big data sets are these things called foundation models that everyone is trying to build. And you know, this one big platform that can be used to do multiple tasks and definitely can be a big difference, especially in data scarce you know, areas as a starting point. But you know, I've struggled with this because, for example, my local dialect in Kikuyu is a dying language, you know, and every time I go, very few people in my village still speak it. And although I can speak, you know, AI has potential for preservation of these languages, you know. And we see a group like Masahane from South Africa trying to document this, just this continental diversity in terms of language and building by Africans from local African dialects. But then I wonder, how good is that, especially if now Google can, not Microsoft, but anyway, but how Google can sell to me things that I don't need in the first place, because now they can understand my language when I talk on WhatsApp or wherever I am. So it's this tension, and initial intents are never ill. But if we don't document these languages, then we're going to be completely omitted when there's a translation service that's built on some of these engines. But at the same time, it's no longer the dark continent. It's all this continent that you now understand because you have a sense of the languages that are there. And so when it comes to I think data governance is to assume that you don't know everything, and it's to assume a learning approach that you look at the use cases you're monitoring, and then you adapt yourself to figure out, is this good? Because when we develop technology, we have no control with how it's used downstream. And in the US, you'd see an example of this for facial recognition. I don't think the developers ever thought that it would be used for mass surveillance. And so the downstream, how technology is deployed is very different from how it's developed, at least today in our world. And so trying to be adaptable and putting the founding pillars, I think, is where you can start, but not be so paralyzed to say, no, I don't want anything to be done on this data.
So I wanted to pick up on one thread, which is the papers that you were talking about that get written and so on and so forth. And from an AI researcher's perspective, it is important that we have space for actual papers that get deployed and used, as opposed to simply showing the technical brilliance of the authors. Because if all that gets rewarded in AI is how brilliant the AI solution was, that's all the papers we will get. And nobody wants to actually deploy anything, because what's the reward for that kind of work? And so fortunately, after having recognized this, at least in some major conferences, which is the primary mode of publication in AI, there are now special tracks, which is AI for social impact, which reward people going out in the field and deploying things and reporting results from, even if it's off-the-shelf AI solution, that's still fine. And this, I've seen myself in my own lab, has led to changes in the way research is approached, because no longer is it necessary. At first, doesn't matter what the problem demands, I should develop some solution with some twists and turns just because that's the only way to actually getting published. And so now, given that these new venues for publication are emerging, there's more of an emphasis on actually solutions that work, showing that they work in the field, and there's a lot more rigor in evaluation, and that's how this work is evaluated. But there needs to be much more of this understanding of this kind of new scholarship, which we don't have right now. And as a result, there's still not that kind of emphasis on the deployment and so forth. So we may still, unfortunately, get a lot of papers that are not actually, obviously there's space for showing these technically brilliant papers and so on and so forth, but there should be that emphasis on scholarship that is really focused on how do you take these solutions to the ground and really be able to figure out what are all the troubles in deploying these and things that don't work and how you resolve those and things like that. So
I'm actually going to transition to the audience now, just because we have only a few more minutes. And we have lots of hands. Let's see. I'm going to go way in the back over this side. Yeah. Yes.
That's
up.
I think that's him, no?
Thank you so much, soon to be Prime Minister. I really enjoyed.
I'm going to stay here now.
I really enjoyed the clarification and the exchange. I really got curious when you alluded to how Sierra Leone develops like a framework and structure for how it hopes to harness and regulate AI. Could you maybe name like inspirations on what developing countries that you feel have created the right structure that your government drew inspiration from? And conversely, maybe the rest of the panel can speak to what are some like counterexamples of developing countries that blaze the path with the path with good intentions, but you disagreed with, and similar global South countries shouldn't follow their footsteps in like regulating the way generative AI is like going to be harnessed. Thank you.
Well, should we react to it?
Yeah, yes, please.
So thank you very much. It might sound like a bit of arrogance, but it's not. It's not intended. What we're trying to do in Sierra Leone is that we're not following averages. We're not looking for the median for Africa, the median for West Africa. We're asking fundamental questions about ourselves. Where do we want to be? what do we need to do to get us to where we want to go? So we have a new department created that started out as a unit within the presidency that realizes fairly early, 7 years ago, that this technology and AI and things like that and digital transformation is going to be vital to what we do. Now they've escalated that up into a cabinet level position, and it's been led by a very, very young, charismatic, smart, bright lady, yeah? And what this does is bring everybody together and looking at what are the problems that we have that we need to solve. And then going back to those, what are the fundamental data in data collection, harnessing, governance that we need to have in place. I remember just even for some of the basic data and some of the basic metrics for measurements, it took forever to declare what do you do for hospital. Is it H or HOS or HO? I mean, huge debate on things like that, but it's setting the standards so that everybody agrees that this is what we're going to be using going forward. So it took a lot of work, but we're trying to solve Sierra Leone's problems. And if it turns out that there are other beneficiaries of it, that's even better. But we're not looking at averages. And it's not being arrogant, because I think what we're looking at is what is the problem that we're going to solve. We'll look at what others have done and mistakes that they've made, but we're not comparing ourselves to anybody. When I took office, I said we will reduce the maternal mortality from 717 per 100,000 to less than 300 per 100,000 in 3 years. In 3 years. And today we've seen that it's gone even below what the expectation is. If we're looking at averages, we'll be saying it takes 10, 15 years to move like 5 or 6 units around there. But it requires this kind of radical action. And, Martin Luther King here, you have a dream, yeah? We have these big dreams, and we're not keeping it as dreams. We're looking at what are the steps that you need to take to get you to realize that dream. So we have a presidency and a leadership that's just, it's not taking okay as okay. We're working hard towards ensuring that mediocrity is not acceptable, So we're challenging ourselves in setting our goals and our targets, aspiring for it.
Sounds like Sierra Leone is going to be the inspiration for others rather than...
After I become Prime Minister.
I'm going to go to a question right in the back first.
Thank you very much. My name is Verda, and I am a student here at the college studying neurobiology. I know there's a lot of talk about younger people getting involved and tech for social. I guess I'll come over here so more people can see me. And tech for social good. And I just wanted to share one thing, and then I have a question following up with that. So there's a...
Brief, because we're short on time.
100%. So we've started kind of what you were saying, an organization called Technology and Global Health Initiative, to kind of bring students from the tech side and global health side, to build technologies for social good. And this semester, one of our first projects was kind of working with Health Tech Without Borders and kind of building technology for them. And so definitely, I think on the student side, we're not PhDs yet, but we're certainly seeing the same thing, and we're excited to work on that. But I was speaking to Dr. Judy earlier, and she mentioned that sometimes when international students kind of come in and work with local organizations on the ground in African countries, it can disrupt the students that are kind of already there, the opportunities for them. Mm-hmm. So a question for all three of you: how do we allow for opportunities for international students to work? Because of course we're happy to help and we want to give back, but also preserving opportunities for students in African countries, because they also are brilliant and deserve the opportunity to give back to their own country.
Very important question.
I guess I get to ask the question that I was supposed to ask on the last panel, which is, or the comment that I actually went to medical school in Kenya, and Kenya has a fantastic North-South collaboration. And so the surgery in the US is moving to minimal invasive surgery, right? So you rarely get open surgery. And when the students would come, because they don't have enough patients to do open surgery, so that skill is dying, we would be pushed away from watching the surgery or assisting the surgery, and they would be doing the surgery. But I'm the one who's going to graduate in a few months. These are the realities. Or the other hand, where we've seen quite a lot of push for clinical officers that they should be doing cesarean sections, right? Yet they have no idea of even what's the dilation of, during labor. And so we see sometimes the tension between healthcare provision and the money and who has the big voice. So not because sometimes it's intentional, but there is quite a power difference. And I hope that as some of the big changes and advocacy that I've seen are a little bit of people who've left and come back on the continent. I think you feel emboldened. In our universities here, you can challenge your professor without consequence. And I think it just brings a different confidence and approach that maybe, we just need to lower a little bit of the power differential, in my opinion, when it comes to the Global South and being in the field. It requires, again, just like every panelist said, a lot of humility to learn, to accept when you don't know, and to really listen, especially because our cultures don't encourage us to be so fond, or say I know, such things. And so if you approach that, and the fact that you're getting students out of their computers to the field is a miracle, and still something that needs to be lauded.
So if I may say, first of all, congratulations on being able to push towards this tech for social good and bringing international students and really getting them to work on these problems. And to a certain extent, sort of connecting to the last question that was asked, while on the one hand we have to sort of do these, think about regulations to control the negative aspects of AI and so forth, we shouldn't lose sight of the kind of work you're proposing to do, which is tech for social good, that there is a positive benefit that we can bring with AI and to promote that. And in some sense, as I was saying earlier, it's not like AI is some natural thing. It's something that we are developing. And so to the extent that we can push AI towards these positive applications and so forth, I think that is important. I also feel, there's such huge global problems that we face that I would imagine that at least at this stage, there's just not enough AI expertise to go around. It would seem that we are quite at a stage where there will be a competition. I think there's plenty for everybody to work on together and to learn from each other. And so I at this point at least wouldn't worry about people being edged out and so on and so forth.
I think we have time for one more question, and then I'll ask our panelists to leave a parting thought for our audience. So one question. Yeah.
Sorry, thanks, Judy, for the earlier shout out. And that was really more about, I think, the Data Science Initiative for Africa, which is a $100 million investment from NIH in building data science capacity with many hubs across the continent. And I'm wondering if you could comment, any of you, on how to really elevate the importance of data pipeline generation. Because as Judy was saying, it's really the foundation of so much AI. And I really don't see much of a future without having those pipelines, but I think that concept is not commonly known. And there are so many organizations developing databases and M&E and all these things that are really untapped. But how do we get that message across?
I think it's basic investment. When you talk to the Minister of Finance that, we want to invest in data harnessing or data harmonization or data gathering, they tell you that, hey, you have a choice. Either I give you the drugs for this patient or you have money for your data. So I think for us, it's really important to be able to articulate how important this is, how foundational this is, not only to the host governments, but even to our development partners, to say it is worth investing here because it's laying the basic foundation for all of the work that you're going to see downstream. If we don't invest in that, how are you going to have these results down the road? And I think to my colleague who asked the question about the neurobiologists or so, I think one of the things that we really need to pay attention to is the team effort. Right? You cannot have an AI solution that siloed, single-handed, being able to work with all of the parties, being able to bring everybody around and say, here's the problem. What do you think the solution is from a clinical standpoint, from a lab standpoint, from an AI? I mean, all of these people sitting together and solving this problem is what we need going forward. I think if we revert to the silos, we'll be looking at that elephant from the ear standpoint or the toe standpoint or the tail standpoint, and we will not be seeing the full elephant.
Thank you. That's a good parting thought from you. So maybe Dr. Gichoya, if you want to comment on the question in your 30-second parting.
I think it's hard and requires team, as you know, that's a big ethos of how I work. I think I want to use my 25 seconds to reflect on what are my parting shots. And I would say for global health, we need to think bold. And we think, when I hear leapfrogging, it's not going to be building another pneumonia algorithm. We need to think about how healthcare is provided. And if I was to put my bet today, it would be really, and it's a very biased bet, it would be minimally invasive surgery aided with robotics care. And the reason for that is that anesthesia is not safe, even in Kenya, even in the US, really, with your dentist. And, but I would say that we just have an opportunity to make sure that, just imagine this, and you don't think about AI alone, that the moment I put a needle in a tumor, that you can get a sample, even if I wait for 10 minutes, and tell me at least what type of tumor this is, and I can ablate it, I can do cryoablation on it, and the patient is, has a treatment at the point of diagnosis. Impossible to do in the US, not because of technology, but of the way care is organized. But we need to be thinking boldly instead of copying something else and saying, okay, here is another algorithm that I need to deploy. And that to me is the challenge, to think big, because the technology is for sure going to get there. And we cannot just copy the things that work or don't work here and just apply them back home.
Thanks.
I think my parting thoughts are led by your example of tech for social good. That really AI can be a positive force, and so not only to think about all the negative aspects of AI, which we've also discussed, and it's important to think about those, but to emphasize all the good that can come about, and for that we need to be able to train a newer generation that can think about these global problems and all of the challenges that come along with it, in being able to develop solutions, deploy these solutions, work in low data regimes, deploy things in a responsible fashion, ethically, and scale up these solutions. These are all challenges for which we need to train a new generation of AI researchers who can push AI in a more positive direction. So that would be my parting thought.
Well,
What's your parting thought?
Well, my parting thoughts are thanks. And thank you to all the panelists. I think you've left us on a note of hope, which might be a little bit different from some of our earlier panels. So hopefully, but thank you for giving us the space to do this as part of the symposium, and for all the thoughts that you shared. Lots more conversations to be had, perhaps some trips to Sierra Leone in our future as well.
Yes.
You're welcome.
Thank you to all of you.